Our first speaker of the day is Dominic MacAskill, who's been the Wales TUC president from 2021 to 2022. He's leader here for the UNISON, the union. He's also been someone that you would have seen on many marches, on many demonstrations, on many picket lines, always on the side of workers, always fighting for what is right and what is just. And I want to say a personal thank you to Dom for all his support since he's been on our executive and our general council over the years. And sadly, Dominic is going to be retiring. Sad for us. I'm sure he's happy. But I just want to say that it's really important that, you know, that the person who comes afterwards, and I'm really pleased that Jess is going to be the person that comes afterwards, keeps that tradition of UNISON fighting to protect public services alive. So without further ado, Dominic, it's over to you.
Thank you, Shavanah. And I'm proud to be standing here in front of you as one of my last public acts as the Regional Secretary of UNISON in Wales. And I send greetings to you all from our 90,000 UNISON Wales members. On the 5th of July 1948, under the stewardship of an Aaron Bevan and Attlee's Labour government, the NHS was born. It was a landmark moment in our history, the creation of a single-payer universal health system free at the point of use. Prior to its creation, the NHS of the UK, or the Health Service of the UK, was a mixture of private, municipal and charity schemes with poor coverage and poor outcomes. Such was the size of the project that, upon its creation, it instantly became Britain's third largest employer. Our National Health Service is made possible by the labour of workers, both domestic and international. The contribution of international workers has been essential to the NHS ever since the very first recruitment drive of Caribbean workers in 1949. To this day, the contribution of people who come to the UK to work in the NHS remains essential. The NHS is one team, and that team achieves incredible things. The first cardiopulmonary bypass programme in 1958, the first kidney transplant and first implantable pacemaker, both in 1960, the first heart transplant in 1968, free breast screening for women for over 50, the first programme of its kind in the world in 1988. And the bravery of every single NHS worker during the pandemic, looking after us whilst being failed by the Westminster government, too busy flouting its own rules and feathering its own nest, rather than ensuring the proper procurement of personal protective equipment. UNISON, we all hope that the COVID-19 inquiry provides the lessons and access to justice and closure that so many people who lost loved ones deserve and need. The Westminster government needs to be held to account to ensure change is made and that we are fully prepared for any future pandemics. In 1969, responsibility for the NHS in Wales was transferred from the Secretary of State for Health to the Secretary of State for Wales, though, as a UK government minister, overall governance and decision-making was still, at this point, with Westminster. It was not until 1999, following the creation of the Senedd, that responsibility for the NHS in Wales was transferred to an elected executive. The financial challenges of maintaining our NHS have been acutely felt since its inception, and they remain to this day. However, healthcare should not be about profit and enrichment for the few. The evidence is all around us. In the United States, over 30 million people are without healthcare. The richest nation in the world with all its resources, chooses to pursue a system that doesn't include universal coverage. The result? A higher death rate amongst those without access to healthcare. Closer to home, our broken social care system, broken primarily because our services are overwhelmingly provided by the private sector with its pursuit of profit, sucking money out of the system, which would be better used to improve and expand our provision. These examples illustrate what happens when our values are inverted and the incentive for profit and gain supersede patient care and outcomes. We always have a choice, both as individuals and as a society. We can choose to continue down this path of a broken social care system and an ailing health service, or we can choose the path of positive change, a path that leads to a health service that is properly staffed, with a thoughtfully planned workforce that is recognised for their service through proper pay, career development and progression, a pathway through the creation of a national care service for Wales with nationally agreed minimum pay, terms and conditions for staff, finally joins our disparate health service together. It is a path that realigns our values, puts people before profit and health before wealth. This is a path that we have no choice but to follow. But it is a path of most resistance, facing down the opposition from the powerful corporate vested interests and their Westminster stooges. But it is also the path of most benefit for our members and the communities and services. Rising together in unison as a united labour movement, we can secure another 75 years of the NHS. We can win, we must win, and we will win for a better future for all.